Well, hey, everybody. Glad to have you with us. And I particularly am glad to have a guest. You may or may not remember, well, doesn't really matter if you do or not, but my friend here is Cindy Herring, and she does work with other folks at Life and Bioimaging,
Molecular imaging.
Molecular imaging. See, that's that. You got to read the fine print, and some of our eyes aren't as great. And what I know is that Cindy's super smart, but she's also really committed, as is their company, and having people who are living with dementia or people who are supporting people living with dementia, understanding what's going on so they can make informed choices. And it's really about understanding and making informed choices. So Cindy shared sort of something that's going on, which not everybody knows about. And it's sort of a unique thing. This is the first time we know, as far as I know, that it's ever really come up and happened. So Cindy, tell us a little bit about yourself and what's going on here and why we want people to know about this. And so they can voice concern or interest or make a statement. So we want to give people that chance to have a voice.
Absolutely. Well, thank you, Teepa, for having me. Yes, I work for Life Molecular Imaging, and my main focus is we have a diagnostic that helps look at amyloid plaque in the brain. It's been FDA approved for years, and physicians use it with their patients. And now what I work on is coverage, what Medicare covers for patients.
So coverage means funding.
Yes. So Medicare beneficiaries can have access to these wonderful diagnostics and therapeutics. So what I would like to make, more patients and caregivers and healthcare providers aware is that the FDA did do accelerated approval for the first therapy for Alzheimer's disease that has come out in the past 20 years.
Right.
It happened this past June. Biogen's drug, Aduhelm, was approved by the FDA with accelerated approval, for Alzheimer's patients who meet certain criteria, right?
Right.
Once FDA approves something, the next step is coverage by Medicare. Yeah. And, can patients have access to this? So the therapies usually go to your local Medicare for coverage at their discretion. But big Medicare decided to do a national coverage decision on this therapy and future therapies of its class.
Okay, so let's be clear. So historically, what happened was once a drug was approved, it was cleared for public consumption. If you met certain criteria, then you and your doctor would determine whether or not you were going to do this. And there was a discussion we were part of. We participated in the discussion. We certainly brought up some issues like, wow, that's a really hefty price tag that we're putting on this. Cheesy Pete, how much? And there was, concern among people that we talk with about, and what does it exactly do? And why are people concerned about it? Because this particular medication that was tested was the testing on it. This is one of the first time that the expert panel was not necessarily in agreement with what the decision was. Which
absolutely
fuzzy. Yeah. I mean, it made it definitely fuzzy. And I'm just being practical. To my understanding, part of the concern is how much it costs when there's this debate going. There's still a debate going on about, is it a good thing that we should be doing, or did we go too fast or what with this particular one? And so my understanding of where they went is, okay, so they're going to do some more work at phase 4, sort of to find out more things about this.
Right.
But that at this point, then, but what do we do? Because the FDA did approve. And so what was happening is some providers, not even Medicare, Medicaid, but other providers were saying, we're not going to cover this. And the thing is, there's a number, people can choose to cover, not cover. Any health insurance company can make choices about what they're going to cover and they're not going to cover. And, usually there's a mix. And so you decide, okay, well, I'm willing to pay this premium so that I can get this kind of coverage. But when you get to Medicare and coverage for things like medications,
Right.
That's Medicare D. I mean, that's a different animal. I mean, but CMS.
So that's different.
Yeah. So this is a different thing. And so this is where it gets real, I want to say the word messy or confusing or not clear. Because now all of a sudden we're talking not only about this treatment, because it is a treatment. It's not just a medication, because you do have to monitor the treatment and you do have to keep track of things, which is where the imaging comes in.
Mm-hmm.
I mean, you have to do some stuff. But all of a sudden now we're talking not just about that one treatment, that one drug, but we're talking about anything that fits in that grouping.
Yes.
They're wanting to do something about. And it's like, that was one drug, but now they're talking about all drugs in that category.
Correct.
Okay,
yes.
So that's where this is like,
it's a little confusing. Right.
Wait a minute.
Yeah. So these are Medicare Part B because this is an infusion. All right. So it goes into Medicare Part B and it's a treatment. Mm-hmm. So what they have done, though, you're right, is a class of drugs. So when FDA approves something at accelerated approval, they want to bring it to the market. It's safe. It does reduce amyloid plaque, but it needs further evidence that that's going to reduce and slow down cognitive decline in all patients. Some it has, some it has not. So there is a lot of controversy, and I understand CMS's concern, Medicare's concern over that, but now they've attached this to the class of drugs. Yeah, and there are 3 companies that are getting ready to submit to the FDA that may have more information, may have done more studies than this one. So it's like they're being punished.
Yeah. So all those groups who may have done more due diligence and may have a different group they're treating or may have a more select thing, but we don't even know that. But what we know is they're being put in the same category as this alzheimer's group. And so all of a sudden now all of them are moving to this not so available to people potentially.
Yes.
And that's one of those that you go like, but wait a minute. Do we have evidence that these guys are, wouldn't be approved by an expert panel in the same way, or that they hadn't done some of the other things that this group did? I mean, it's like,
let's wait for those to come. They shouldn't be kind of categorized based on this first one that came out.
I mean, this is very different behavior than we've seen before.
Yes. So yes. I mean, cancer drugs don't get the same treatment. They've come out and patients in their professional oncologists decide, is this for you or not?
So right? I know I've heard like, well, you could bleed out, you could die from a stroke, you could, you could have a heart attack, you could do this, you could do that. However, it has been shown in general that it does lengthen your life, even though you've got a condition that is going to kill you. It does actually extend your life and improves your quality of life for whatever. And so for those cancer drugs, I mean, you hear all the stuff and you're thinking, boy, I'd have to really need it to want to do that. But I mean, that's a choice that you and your provider would be thinking about. Okay, so I understand my risks.
Yes. So exactly. And I think the other interesting part of this proposed rule that, people can read about with the link is that now Medicare wants to cover it under what's called coverage with evidence development, which means they will only cover patients whose neurologists are also participating in approved clinical trials, and it has to be in a hospital-based setting. So this even decreases patient access and diversity.
So, I mean, we know people who have actively been involved in the Alzheimer's study and who wanted to continue and were planning on continuing, because for them, some people didn't, some people did. This, I know one individual I've spoken to individually, and she said, I'm really scared right now because I know I can't afford this out of pocket. I mean, there's no way I can afford it out of pocket. And I should, I've been in the study and everything. And, the evidence that I'm looking at, I am taking the medication now. I know that, I wasn't sure for a while because it was blind, but now I know. And now there's this possibility that I won't fall into the category that allows me to do it.
Exactly.
And so there's this sense of, but wait, why? I don't understand. And, she's right. It's hard to understand. So I think what we're talking about is wanting to let people have a voice in something that's happening. It's the first time it's ever happened, and feel like, wait a minute, why are people living with dementia and their care partners possibly being treated as a group of individuals that's different than any other category, including people truly who have cancer that is killing them? I mean,
Right.
whatever they're taking as an added thing, it's not changing that they're dying from their cancer, but how they're living is different, or how long they stay alive is different. And people are opting to participate in that particular medication and treatment.
Yes.
And yes, it has to be monitored, and yes, it's expensive. But, for them, they want that part of their life. And particularly, we've heard most, I will say, from people with relatively young onset Alzheimer's or other forms of dementia, who really want to not lose their ground. They don't want to lose ground, but they also don't want to lose their life prematurely if they can avoid it.
Exactly.
They'd like choices. So,
yep. And that's what I think this is about, that I wanted to bring it, to you and people who listen to you, and caregivers and patients, to go on there and comment. These comments are very important, and we only have 30 days. Ooh. And this started on January 11th. We have to make our comments by February 10th. Ooh. It's very important.
So it was flying for many of us. I think there was some kind of chatter, but then it went down because there's so many other things to pay attention to that it's easy to miss something like this, because we just knew there was more controversy. There were some people coming out, experts, that were saying, we don't think Aduhelm is da 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 da. And so people could get sidetracked on that particular med. And the thing about this isn't just one med. This is a class. And that's probably, for many of us, the thing, it's like, and we know that there are 2 or 3 other ones that are already in process, and it's like, ouch. Right now, that's an area that people have done a lot of exploration. If they're getting to that place where you might be able to try something, and you're a risk taker and you want to try something, then we're taking away that option for people. We are taking away that option.
So, and I think, Alzheimer's patients, caregivers, your voices need to be heard.
Yeah.
You might have been on this. Now you can't get it again. It's up to you and your physician.
Yeah. Or you agree, we shouldn't be doing this. Well, that's fine. But what you want to do is say what you believe and think, and read through this and see where you're at with it.
Absolutely.
Because what we think is the people who are most impacted should have a voice, is what we're saying.
I agree. Yes.
The experts out there, quote unquote, when the experts who are living with this are available, and we're not checking in with them maybe as much as we could and should, because people have opinions about people living with dementia that are inaccurate.
Yes. Absolutely. So I really want them to read this and to please speak your mind. You can be for it, you can be against it, but you have a right to your own opinion.
Yeah, and you should be heard.
Yeah.
So we are going to share out the document that Cindy put together that has all the information in it. And if you look at that and it tells you where to go and how to go and make your comment, we have to do it by February the 10th.
Yes.
And so we will be putting this out, sharing it up, and then we encourage you guys to go ahead and make statements. And you can also just be a professional who has an opinion. You don't have to be someone who's living with dementia or a partner, but we certainly want those people for sure counted in this mix. But I think anybody in the US who's co-sponsoring Medicare, Medicaid should definitely have some say in what we're sponsoring. So
yes, already 367 comments on the webpage. So please, let's keep doing it.
Giving it. Yeah.
Yes.
So thank you, Cindy, for spending time getting this to us and creating this information set that we can look at. And thank you for the work you guys are doing to help give us different ways to look at human brains, investigate what's happening, and help people figure out what they should do.
Great. Thank you so much.
My pleasure. Thank you so much. Hi, I'm Teepa Snow, and you just found our YouTube channel and watched one of our videos. I'm the owner and founder of Positive Approach to Care. Thanks for watching. And if you liked, if you have a comment about, or you would, please share it with people you know. Oh, and if you haven't yet done it, consider subscribing. We'll let you know when the next new video comes out. And you might want to visit our website, www.teepasnow.com, where you'll find other resources as well. See you there.